Karen Harkaway, MD, graduated from Duke University and completed her medical degree at the University of Pennsylvania. She serves as the Chief of Dermatology at Lourdes Medical Center of Burlington. Dr. Harkaway is board certified in dermatology and is a fellow of both the American Academy of Dermatology and the American Society of Dermatologic Surgery. She teaches physicians across the country in laser and injection techniques. Dr. Harkaway is the medical director of the Harkaway Center for Dermatology and Aesthetics in Delran, New Jersey. So I just want to let everyone know that we will be taking questions tonight. Please feel free to enter a question at any time during the presentation, and we will open it up for questions at the end of the presentation. Again, we'll try to get to as many questions as possible as time permits, and any questions that go unanswered, we'll follow up at a later time. So I'm going to hand it over to Dr. Harkaway. Thank you very much.
Okay, thank you so much, and welcome everybody. And I'm going to go through this as kind of quickly and effectively, hopefully, as I can, so that we can get to some of your questions. We're going to begin by learning a little bit, and it is fairly disturbing news about what's been going on in the healthcare system. And if many of you, like me, are in private practice by yourself or in a small group, we have times of the year that we know we're going to be busy. We have sometimes, January, February, for example, where we expect a little bit to be slower. But sometimes we get slow and we don't know why. We're like blind mice. We don't know what's going on around us because we're just in our own small little worlds. And for the most part, we don't have access to a lot of up to the minute, essentially, information like we're being provided here tonight. So this is very fascinating. These guys at Aerolaser are very dialed into this whole situation that is evolving even as we speak. We have added slides to this slide deck within the last week. So this is absolutely up to the date, up to the minute knowledge about what's going on. And things are changing rapidly, and they are changing in a very profound way that can really affect us all. So what's going on? We're seeing that no one's staying in their own little lane. Insurers are becoming providers. United Healthcare is not only an insurance company, they have their own providers. Humana, same thing. Providers also are becoming insurers, such as we've seen in Kaiser, Sanford Health. And the new thing is that big retail brands are starting to merge into these arenas. Mainly, we're going to focus today on what we're seeing with CVS Health and their Minute clinics. Okay, so all the entities are trying to go after patients directly and to treat them. So they're going after insured patients or even self-pay patients, and everybody's trying to take a little piece of the pie. Everybody's, essentially nipping at our heels, as it were. The goal is to cut independent physicians out of the equation unless their demands are adhered to. And we'll see this in a couple slides coming up. So CVS, for example, and Walgreens, this is where things are changing rapidly. And you can see some of the quotes here. We're really much more than a pharmacy. We're on the front door to a path to better health. Why not use these locations as a strategy for healthcare? We have the space and we should use it. And the Minute Clinic is really the focus of a lot of the changes and becoming the partner of choice for all payers. This is all from CVS. CVS is targeting the most populous and the wealthiest areas. And we're going to take a look in a minute. They do have a balance of payers. They have patients coming that are insured, self-pay, and from government assistance. And here's the maps showing where the concentration of the Minute clinics are. And as you can see, they are in the wealthier parts. They are in the most populated parts of the country. So areas that are big cities. They're not going after, they're not trying to do good work and going into the poor sections or the sparsely cared for areas. They're going directly where the money is, where the people are. And as of 2017, 2018, they have over 1,100 minute clinics. And so, at first this appears to be, something that we've seen already, these sort of urgent care situations. But if you think about it, this is a partnership between CVS and Aetna. Okay, so they've merged. So now we have an insurance company, and we have pharmacy partnering together. And they're opening minute clinics. So what are they doing here? They're getting providers, generally in the form of nurse practitioners and physician assistants. They're actually looking specifically to go for dermatology patients, for dermatologic conditions, as something that they feel they can see right there in their minute clinics or on video conferencing, $59 video conference. And here's a partial list of dermatology conditions that they are actively seeking: acne, rosacea, psoriasis, hair loss, all of the kind of bread and butter stuff for us in dermatology. And patients are using this service more and more because a lot of us dermatologists have waits. They don't want to wait. They want to get right in. They go to the minute clinic. But how are they being treated there? Essentially not well, as we're going to see. But this is a slide that we just inserted within the last week. This is an actual screenshot of Dr. Kindred's phone, what she had to send out to her patients. I believe she's in the DC area. She had been with Aetna, and Aetna turned her down for reapplication, saying that we are not accepting new providers in your field of practice at this time. And she was also told that they had an adequate number of dermatologists. Now, in fact, there is a shortage of dermatologists in that area, but what they have is many minute clinics. So any of us could at any time be told, you know what, we don't need you anymore. We have enough dermatologists. So she was forced to send this letter out to her patients saying, sorry, you can come and see me and pay cash, and she hopes to get back on it. All right, for some reason, I'm not able to move the slide forward. There we go. Okay. And Aetna's actions are part of a bigger trend. Companies, large corporations, in their efforts to continue to provide healthcare insurance for their employees, are finding it, of course, more and more and more expensive. And so they are banding together to create a health transformation alliance. And they are building out a preferred provider network, and they are in charge therefore of directing the dollars as they see fit. I can't move this one. Thank you. So when they are able to leverage their size and their ability to negotiate as a group, they are absolutely changing how healthcare is delivered. And here's a quote: "Our healthcare system is broken. Others have tried to fix it, but the approaches have been the same, and so has the result. They aim to modify and improve the current provider delivery system, among other goals." Okay, wait, I think we both moved this there. So Walmart, GE, Boeing, and Lowe's have already begun to bundle their healthcare services for employees directly and establish these centers of excellence. So they're negotiating with specific providers who will accept lower payment than what would be a traditionally fee-for-service payment. And then they're grouping them in centers of excellence, and you are directed, if you're an employee, this is where you then must go for your health care. And if you don't, as a provider, if you don't join their centers of excellence and accept their terms, If you even wait a little bit, that can mean exclusion from the network. And interestingly, that they're making their employees go to these centers of excellence, and they will even cover travel costs for their staff. It is more advantageous financially to cover some travel costs associated and still keep their patients within a small group rather than have them utilize their own physicians. Okay, next slide. It's not limited to national companies. GM is doing this. They use a single hospital system, the Henry Ford Health System, for all of its salaried employees in the Detroit area. And they cover everything from doctor's visits to surgical procedures. Next slide. Okay, and 11% of employers say they plan to do such broad deals with healthcare providers next year. So they're going to increase this significantly. This is a new trend. It's going forward, and nobody's stopping it at the moment. Next slide. No one is safe. This came up within the last 2 days. We put this slide in. So there is a physician specialty pharmacy, one of the specialty pharmacies that we frequently use in dermatology, that help doctors get branded medication. CVS and Aetna saw that too many patients were being filled branded prescriptions, did not like the cost that the pharmacy was accruing, and said this letter, which is hard to read, but essentially says, you cost too much, you owe us money, and as a result, we are not paying you. They withheld revenue from, I believe, October 1st on, all of a sudden from Epic. The pharmacy benefits managers are doing that. And interestingly, in our local newspaper, I'm in the Philadelphia area, so the main newspaper, the Philadelphia Inquirer, has been having stories last 2 days about pharmacy benefits managers and how they're not direct employees of the government, they're not direct employees of the pharmacies, they're kind of their own little world, and they're able to do whatever they want. It's unbelievable. Okay. The government also is trying to push a major change. As this quote says, this is one of our prime goals at CMS, to get rid of fee-for-service. So we are really on the precipice of a major, major change in the way healthcare is delivered and paid for. And in our own little practices, it's very, very, I mean, even the big people are having a difficult time figuring out what to do with this, much less someone such as myself, who's, my own practice. It's a very daunting situation. All the large players are circling around us in our practice. It's the perfect storm for independent physicians. So our medical dermatology revenues are at risk. But what can we do? So here's a slide that first gives us some thoughts about how we can possibly fight back. So with CVS and Aetna, the Minute Clinics expanding into prescribing treatments, they're going to have all the same generic-based cookie cutter, same treatment regimen for every patient. We can fight back by offering new treatments that show results faster and more modern than what the nurse practitioners at the Minute Clinic can do. As far as insurance and corporations trying to build a stronger relationship, we combat this by offering personalized, differentiated, modern treatment experience that leverage technology and stands out from the cookie cutter corporate medicine that these areas are certainly going to be. And having the employers move together to remove their staff from commercial insurance, we offer differentiated modern treatments that keep patients coming in even in the face of their employer-sponsored providers. Again, a summary. We all know we need to make more money to keep up with declining reimbursement. We also need to stay ahead of the treatment curve with advanced care by adding services that provide significant results. We have to look at how we are currently treating diseases. Are there better ways that we can address them clinically while driving profitability? And it really is not enough just to extend into services like aesthetics, anti-aging, or something else. We have to be advanced in our core medical treatment offerings for acne, for psoriasis, for other inflammatory conditions. So how can we do this? How can we be more advanced and competitive while making better profit margins? We can use the NEO. So now we're segueing into the part of this lecture that discusses what is the Aerolase NEO and how is it different and how could it possibly drive revenue to our office and how can we stand out by using yet another laser when we all have lasers sitting in a room or in a closet that we're not using, and here comes a new laser saying, yeah, we're the one. So I'm going to tell you right now about the NEO, which I've had now for only a couple of months, and yet I'm already buying a second. So this is it was a big investment for me, but certainly not as big as many of the other lasers, but it has absolutely revolutionized my practice, and I'm very eager to tell you about this. And interestingly, this does tie into the first part of the lecture because as you'll see, they're going to all be the same, using the same national combinations of generic prescriptions. We can stand out by using something such as the NEO, which is new technology, and most importantly, it works. So we can have effective treatments for our common dermatologic conditions. We can have effective treatments for our common aesthetic conditions, all with one laser, and therefore we can stand out and have profit margin. So most dermatology patients, interestingly, are seeing 3 to 5 different doctors before finding the one that solves their primary concern. So again, with all these competitors, how are we going to grow? Interestingly, consumers see cutting edge technology. That's how they determine if a physician is highly qualified. For example, in my office, I have iPads. I have wall boards that are essentially computers. I have standing iPads that has advertisements going through them. And people just think that is, wow, Dr. Harkaway, you are so, high tech. And you can see that for them, they don't really know that well other than, potentially looking you up on the internet and seeing what are your scores or where did I go to school or things like that. But they look around and they see that as a sign of quality, as technology that they can infer makes me better than an average, let's say, dermatologist. The NEO, again, can be cutting edge technology, gives fast results that patients can see and feel. So with the NEO, we will have gold standard treatment, faster results, and a combination of mechanisms of action that would absolutely take multiple treatments to achieve. Okay, trying to get to the next slide. Okay, let's go to the next slide, please. So someone came into my office several months ago and said, I have this new laser and it treats acne, it treats rosacea really well, it treats melasma really well, it treats psoriasis, and it does facial rejuvenation. And don't you rent your lasers for spider veins? And we treat that also. And of course, my first reaction was, that's just baloney. That's the kiss of death for any laser salesperson to say that their laser can treat everything, because in general that means they don't treat anything well. So I really didn't pay attention for a long time as they were, blah, blah, blahing during the lunch. And at the end, I started to think, I use the extract for psoriasis, and I know I'm paying a lot of money for the cycles. So perhaps if this does even one other thing well, maybe it is worth investigating. And I can just spend my money instead of spending it towards extract treatments, we can put it into, buying this laser. So I had my practice administrator figure out how much money we're spending each month for extract. And then I called these guys back in from Airlays and I said, look, I really didn't pay attention that well last time, but now I'm interested. So they came back again and I really looked at it. And of course, the first thing to wrap your head around is why and how does this laser treat so many things? And I will tell you now that I've been using it, it not only treats many things, it treats many things tremendously well. It's a game-changing device in my business, in my practice. And when I say we, I mean myself and my physician assistants, we're all using it. We're all wrapping our heads around the many crazy things it can treat, in addition to the normal things it can treat that we're going to tell you about here today. Well, two reasons. Number one, the incredibly fast pulse duration. So the pulse duration is 650 microseconds. So I knew a microsecond was pretty quick, but I wasn't quite sure. So I said, Siri, how many microseconds are in a second? And it turns out that there are 1 million microseconds in a second, and these are 650 millionths of a second. That is the pulse duration, which is lower than the thermal relaxation time, which is what makes this so safe. The targets, which are water, hemoglobin, and melanin, are only being targeted. There is no spread of surrounding effect because the pulse duration is below the thermal relaxation time, which means it stays only there, and it is a very safe technology. But also being that we're putting such power into such a tiny pulse duration, we are getting significantly deep penetration, and that power is able to go all the way through down into the dermis to the very bottom of the dermis in some instances. And that's why we're able to treat dermal melanin. That's why we're able to treat vascularity that goes throughout the dermis, as well as the epidermis, of course. And that's what makes this such a revolutionary device. Okay. So we're going to talk about these several different diseases or skin conditions in the case of rejuvenation, but there are others. Many inflammatory conditions. For example, I just had one of my PAs just treated a woman with severe seborrheic dermatitis, which of course is similar to, but not exactly the same as psoriasis. One treatment already doing better. We had treated her with every seb derm medicine in the book, and she's a very critical person apparently. My PA was so happy today. She's like, I can't believe it. So this was great. She had one treatment. She's already very happy, the patient, and she'll get a couple more. Oh, by the way, she also treated even the seb derm inside her ears, which is, think about that. That's pretty interesting. So let's start with acne. Okay, here's bread and butter. This is the breadiest and the butteriest of our conditions, right? Acne in the dermatologist's office. So using the energy laser light, it decreases the sebum production, it suppresses inflammation, and it kills the P. acnes bacteria. So essentially, this is the first non-prescription treatment that addresses the precursor to acne, the sebum production. And patients will say immediately, like within the next 2 days, their skin feels drier, less oily. The pore size, which is just garbage in my opinion. Whenever I've heard anybody say it reduces pore size, I just think that's baloney usually, but I have absolutely seen this happen already in the short amount of time that I've had this laser. And with you do a background treatment on the area, like let's just say the cheek. So you're going to do like 6 quick passes, and then you take the bigger 6 millimeter handpiece off, you dial down onto the 2 millimeter handpiece, and you treat each individual inflammatory lesion, and they look much better pretty quickly. Okay, for example, this is a patient of Michael Gold in Tennessee. This is someone who had failed 3 courses of isotretinoin before starting treatment. And here the patient is 13 months after the only 5 treatments, an unbelievable response. And Michael Gold uses this all day long with acne. And one thing that I think you'll see if you look at Aerolase's fairly extensive photo gallery in their marketing materials, very nice. It was one of the things that stood out to me once I did start paying attention, that most of their photos are from all different people. It's not from the same old laser people that we see all the time. These are a lot of different people across the country getting the same results. Okay, here's another patient, a patient of Kevin Pinsky's. And that's pretty significant. Here's someone after just 1 treatment, Michael Gold again. And look what you can see in this picture. I like this picture quite a lot. You can see a decrease in post-inflammatory hyperpigmentation, in active acne, in red marks, and look at their skin tone and texture. It's not as bumpy, it's smoother. They obviously still have some acne lesions, but this is 1 treatment. And did we forget to say, it obviously can treat any skin of color. It can treat tan skin. So this opens up all of these treatments now. We can treat all of our patients. Obviously, many lasers are not able to treat skin of color with good response. Acne patients see less red, less painful, less oily, pretty much right away. So the physician assessment is that it's dramatically better after 5 treatments, but also at least 25% clearance after 2 treatments. Patients have a good experience. It takes 10 to 15 minutes. The average number of treatments is 5. I tell people 4 to 6, and you can treat them weekly for acne. So it boosts profitability and results both from conventional therapy where they're coming in for a visit, and now this is an out-of-pocket expense. The recommended treatment price, and of course everybody sets their own price, but for acne, I've stuck with what Aerolase has recommended, which is $200 a treatment. We want to be able to treat these people. It's a pretty quick treatment, especially after the first one. You really only need to treat the active lesions. $200, money in your pocket, and so you can see the difference. You have a more satisfied patient. You have better profitability. Psoriasis, we're going to look at. Again, this is covered. Now, this is a covered procedure, the treatment of psoriasis, just like it had been with Extract or any other laser that treats psoriasis. But it treats it better. Why? Because, again, the pulse can go so deep into the dermis and can penetrate the thick and scaly epidermis. It helps get rid of all the inflammation, the blood vessels that are continuing the psoriatic lesion, and it shows quicker clearance than using the eczema laser. Here's an example. This is a woman at the Mayo, 6 months after her 8th treatment, and obviously, you know, palmar plantar psoriasis is quite debilitating. Here it is again. Now you can't use it on the scalp because one of the other things that this laser can do is remove hair. So no scalp psoriasis treatment. This is just 2 treatments from Mark Nestor. Again, physician assessment, dramatically better after 10 treatments, but also early clearance. Majority of patients are either satisfied or highly satisfied. It takes 10 to 15 minutes. And the average number is about 10 treatments, which is far lower, far fewer than what we had been using for the extract. Again, here's the neo using the insurance payments average for this treatment. So this is not a cash payment. This is insurance payments. But your conventional therapy, you see a patient once every 2 months or so, and you get an office visit. And here we're having therapy patient revenue for being treated with the laser once a week or once every other week. Onychomycosis does very well here. There's no, obviously, since we're treating with a laser, we don't have any risk of liver damage. Not that there was a significant risk with Lamisil terbinafine, but patients had that perception, of course. This kills the fungus, destroys the spores as well under the compromised nail, and it will penetrate deep enough to get under there, unlike many other lasers. And here's an example. And obviously, since I myself have not had the laser that long, I can't say that this has been my own experience. I did treat 2 people so far, but haven't seen them back yet. But my understanding is that it really, at this point, people are treating just once and it's growing out, and that's it. Many people are doing a digital block in order to achieve this result because it is a little bit painful. Here's someone that had 2 treatments. But interesting, this almost doesn't look like onychomycosis to me. I wonder if it's somehow psoriasis of the nail, which it would probably work for too. Okay, so physician assessment is improved. Patients are satisfied. I'm hearing 1 treatment now, so I don't know if but let's even say conservative and let's say it is 3 treatments. Still very effective. Okay. And again, the payment, depending upon how many treatments it could take. And people are willing to spend even for 3 times at $300 or $350 a treatment. But what I think has been the best and that I've used it for the most so far is absolutely skin rejuvenation. And of course, you can make the argument that melasma and rosacea are medical conditions as well. So this is where it all begins to blend together. And for my colleagues, many dermatologists don't do a lot of aesthetic treatments, and it's been their choice. But the lines get a little blurred here, and I think in a way this is great for everybody because even if you're a medical dermatologist who does not do Botox or fillers, your patients are going to be very happy with the treatment for rosacea, for melasma. They're going to look better on a lot of different levels, and we're going to see this here. Okay. So when you do essentially the full facial treatment, which we would do the same treatment for rosacea, for melasma, for skin rejuvenation, tightening, collagen improvement, you're treating it in exactly the same way. So everything occurs simultaneously. It is addressing texture at the same time as redness, at the same time as pigmentation, at the same time as laxity and pores and sun damage and veins and age spots. Now, sometimes we can, at the end of the treatment, if you have spider veins, let's say, then you're going to switch your handpiece and deliberately treat them. But the whole treatment altogether does all of this at the same time. Patients have mentioned this shrink wrapping feeling that they get, this feeling of tightness. And I've had several patients, not just 1 or 2, but several, get up from the table, look at their skin in the mirror and say, it looks better already. And I've frankly never had that to that degree with other lasers. We all know there's a placebo effect, of course, with everything that we do. And you got to wonder sometimes, how much of that is happening. But I've had patients that are really not that way, not likely to be overly happy about things, who really were. And certainly by the time I see them back in 4 weeks, they are absolutely happy. Okay. So as Kevin Pinsky astutely points out here, Normally, the treatment of this range of conditions requires 3 to 4 different types of lasers. I'll give you an example of a woman I had in my office last week, African American woman, late 50s. She still had some acne. She had some hyperpigmentation from the acne as well as some melasma. Um, she so these were her main complaints. I said, okay, we're going to use this laser called the Neo. And here's why. Number one, you're African American and this can still treat you. Many other lasers cannot. Number two, it will treat your dark spots that you have. Number three, it will treat your acne. Number four, you're over 55 years old and we all can use skin tightening and neocollagenesis. That's going to help, your tightening and your fine lines. Oh, and as I'm turning her head from side to side and putting my thumb underneath her chin, I feel a little bit of stubble there. And I said, shave before your treatment because it is going to get rid of that hair as well. So it's actually quite well for hair removal. So this one person had 5 indications for this laser. It sells itself. It sells itself. People are just taking the brochures. I'm talking to them about it in a three sentence conversation, and they are, setting up appointments for this treatment. Okay, so here's an example again, one of Dr. Popinski's patients. And look closely here. You can see not only is her cheek tighter, and not only is the marionette area pulled up and the nasolabial area pulled up, but the skin texture is better. The jawline is better defined. There's decreased redness. This woman looks so much better, all naturally, all normally. I mean, people are loving this. This is my patient. She came in, she's 71, and she was very afraid. She's never had anything done. And she came in when she came in to me after one treatment, she said, well, it was, it didn't hurt or anything, but I haven't really seen any difference yet. And I said, oh, yeah, yeah, I mean, it's only the first treatment. Maybe you're not going to get an improvement yet. But then I kind of looked and I thought, I think she might look better. So let me take her pictures. So as you can see, looking at the patient's right cheek, on the left here, that line coming down on the left is significantly decreased. Her marionette folds are decreased. And when I show you her side pictures, yep, here we go. So she's not there yet, clearly, but look at all the fine lines that have decreased. Look also at the jawline, which is improved. Let me turn to the next one. This is a patient of Jason Emmer showing the décolletage. Here's an area where frequently you're never getting any significant improvement. And look at these lines. They're gone after 4 treatments. Many of us lie on our sides to sleep. We just can't go on our backs. I've tried a million times. And we know that this is, going to happen. So now it's nice to have a treatment for it. Let's turn now to melasma, which is, I think, one of the things that absolutely does the best because we're treating the pigmentation, whether it's epidermal or dermal, and we're treating the vascular component. Okay, here's a photo courtesy of Dr. Burgess. You can look at this and know it's dermal pigmentation. Okay, when it fades like that, it's almost always dermal. And of course, she's an African American patient, so you're already saying there's 2 strikes against a good, effective laser treatment. And yet, this is the patient after just 1 treatment. Another patient after 3 treatments in a peel. You can see the significant improvement in both the browns and the reds. So melasma therapy summary. dramatically better after 3 treatments. Patients are satisfied, short duration of treatment, and 3 treatments is all that's needed. Again, a significantly different cost per patient treated with the NEO compared to conventional therapy. Okay, we're moving on here now to rosacea. Again, it coagulates the pustules, the capillaries. You can shrink sebaceous glands with this laser as well. You can easily treat sebaceous hyperplasia as part of your foundation therapy. And I've come to realize I really like that term, neo-foundation therapy, because in fact, I'm almost looking at all of my patients in a different way now. And when I reassess them, since I've seen them, anybody I've seen prior to October, I'm reassessing because now I know, and I do believe that, NEO is the foundation therapy for everything else. So we start off with NEO even before I'm going to do some filler or some this or some that. That's my plan going forward because they're going to get tightening, they're going to improve their tone and their texture, and then we're probably going to be left with, obviously, we're going to need Botox and filler and maybe whatever procedures you do additionally. But this is the foundation. We're laying the foundation for better skin from which then we can do our other significant improvements. Okay. And the redness, we've never been able to achieve this with IPL. We've never been able to get rid of that significant background erythema, which we are absolutely doing very, very well with NEO. This is one of my patients, again, one of my first demo patients. So I did him for free on the day that they brought the laser in just to show me how it was working. This guy didn't like the way he looked, but he was a big baby when it came right down to it, and he was, because I was dialing in on a lot of these papules and a lot of his blood vessels, and you'll feel that, the baseline treatment, when you're just doing what I call the passes, you do sort of 6 passes in each area of the face, that feels warm, doesn't really feel painful, but once you dial in on either a lentigo or an angioma or a vein, they'll feel that, or an inflammatory lesion, they're going to feel that. But here he came back, he was happy as a clam, and look at the difference. One treatment, look at the decreased erythema. We're going to show this side. I treated the blood vessels in his cheeks there. He wouldn't let me treat that angioma up there, although I was, of course, jonesing to, but by that time he's like, all right, enough. I'm sure I'm going to look better. And I think we have the other side here. Yeah, where I was able to treat a little bit more. A significant improvement. And this guy was just thrilled to death. And so again, patients are happy. People are doing great. Doesn't take very long. I usually just tell people 3 to 4 treatments, but I know that a lot of them are going to do well in 2 to 3 treatments, but you want to prepare them for more. Again, significant increased financial gain for us treating them in this fashion, and we're treating them better. And they don't have to be on oral medication or, topical medication all the time. So bringing it all together, we can have salvation. You can have the same day treatment. Now, once you have a little room for this, you can just, and it's a very small laser if you haven't seen it. So it can be, the laser itself can go from room to room. You can have its own room, however you want to do it. You can treat them the same day. In many cases, I do that. Can be combined with other treatments, can be delegated. Certainly, I'm in New Jersey. My PAs, nurse practitioners, can do it. In other states, I imagine estheticians can do it as well. And it brings us, it's interesting, it does absolutely bring us closer to the original motivation for entering medicine. I got to tell you guys, this is fun. This is so much fun. And I hate lasers because lasers are boring. I mean, who wants to treat? It's the same boring going across. I don't really like doing laser treatments. I'd much rather do filler or surgery or liposuction or thread lifts or a lot of other things. But this has been so much fun. And it's not because the treatment is fun, the treatment is boring, but it's fun because people are doing great. And it's fun to see all the different things that we can treat. We can treat, I started treating granuloma annulare the other day. I've heard of other people treating lichen planus. Now, questionable, of course, whether we're going to get, compensated for a laser treatment of these types of conditions. But it's interesting to figure it out. And if we are able to, then maybe we will get laser treatment paid for, or maybe patients will pay out of pocket for it. Or at the very least, if they have to come in once every 2 weeks for a laser visit, then it's an office visit. And we're still doing better because there's no consumables with this laser. So every time you fire it up, it's not like you're costing yourself anything. And it gives you control over what we do. It's exciting. The patients are happy, and it reclaims we as dermatologists of being we're the ones that get cutting edge results. It's a happy work environment, no question about that, and loyal patients. And again, that's one of the things that we're looking for given this new change in healthcare delivery. We want patients that know that you're not going to find this kind of thing at the Minute Clinic, at least not in the next few years, I assume. Okay, I think that's it. So let's open it up to any questions that you may have.
Yeah, thanks, Dr. Harkaway. So, like I said, we're going to open it up for questions. Again, please type it in either the chat box or the question box if you have any questions for us. One that I want to ask you, Dr. Harkaway, and so you touched upon, neo foundation therapy. It's kind of a newer concept. I mean, as a derm, you're primarily used to, shelling out either prescriptions or medications to treat some of these conditions. So I know you're new to the neo, but I want to just ask you if you have any patient reactions to starting with laser as opposed to just filling a prescription in your practice.
So I do think that in some of the real medical people, like for example, that gentleman who had rosacea. Now he had already been on a bunch of things, so he was happy to do it. He probably would have paid for it because at this point, if you're treating rosacea, that's now a pocket expense to treat them with lasers or with this laser. To take someone who just has rosacea and you've never been treated with any medicine, I think it depends upon what else is going on with them. Once you can show them that, you know what, you're like that woman I was telling you about. She had acne, she had this, she had this. If I would take a woman in their 50s that has redness, some rosacea, some pustules, some lentigines, and she wouldn't mind having her face tightened, then absolutely they would go for it. But sometimes I do think that we're going to have to discuss it with people. I can give you a prescription, but most of the time people are coming in, their primary's already given them something, and they know it doesn't work that well. They've had, rosacea is a chronic condition, so they've usually been around the block with this. It's not that often that I'm the first person to make the diagnosis of rosacea, let's just say.
Okay. Yeah, and I think that's an important concept, especially for people that have, not been happy with conventional therapies and they are looking for something advanced. So I do think that definitely sets you apart. You mentioned that
absolutely.
you
I mean,
had.
that's the case with acne. That's the case with rosacea. That's the case with melasma. All of these three conditions, again, bread and butter dermatology. Not a day goes by that we don't see one of those three conditions at least once. And most of those people have already been treated by the time they come to us. So they may innately be interested in having laser treatment done because they've already gone through several treatments and been unhappy.
So along those lines, have you been able to treat with the Neo in combination with prescription at all for any of these conditions?
Oh yes, absolutely. I mean, there are people who have remained, for example, on Retin-A for their acne, and people who have stayed on Finacea for rosacea, people who've stayed on hydroquinone a bit for their melasma. Sure.
Okay. I got a question here from Dr. Gupta. Any restrictions on using the NEO based on the patient's disease history?
Mm, nope. Not that I can think of.
Yeah, I think that kind of speaks to the safety of the actual device itself. In terms of the patient tolerability, how are you finding that for patients versus any of the prescriptions that they've been on? Any side effects, any adverse effects?
No, I haven't seen any adverse effects. I think I've changed up a little bit what I've told people in terms of pain or downtime because it depends on, as I get better at this and use it more and more and more, I learn a lot about what I'm doing with it. And if you're just doing the passes, if you're just kind of staying with the 6 millimeter spot size and blanket treating the area, I will tell those patients, look, it's very, very comfortable. It's going to feel warm. You're not going to have pain. You're not going to have downtime. But anytime that I'm dialing in on a lesion, anytime I switch out that handpiece and go to the 2 millimeter, then it almost becomes like a different laser. It's just like a KTP, or it's just like a pulse dye. So then, or Q switch YAG for Lentigo. So then you're destroying, and you will have a little bit of scaliness and crustiness perhaps, and they'll feel that also. If you're tracing out blood vessels, they're going to feel that, just like with the other lasers that do that. So I've changed, obviously those people, they need to know that. The other thing that I realized, I was doing one patient and I realized that she had a lot of lentigines, but they were pretty dark. I think they were very, very superficial in the epidermis. And it almost was like, wow, this is like a pulse dye almost, because the laser was flashing a little bit and she could feel it, and it was darkening right away. And so, I mean, she'll get a great result, but that taught me that some of these patients with significant sun damage, perhaps the first treatment, we better say, hey, you may get a little downtime. These lentigines may turn quite brown. You may feel it a little bit. Still, it's nothing like pulse dye and IPL. And I would hasten to tell people, physicians who are starting this, if your patients are used to an IPL and they're kind of like, wow, that third day they really see those brown spots coming out, and that's how they know that laser treatment that they just paid for is doing well. They're going to be like, what's going on? Because a lot of times nothing happens for a while. It just gradually fades. That's why I think it's so important. I hope that you have the ability to take pictures, as I do with we have Emma is our practice management or our EMR, and we just take pictures right off our iPads. And like that lady that I showed you when she came in, I mean, she was shocked when she saw those pictures. So that worked out really well.
Okay, great. A couple more questions for you here. Would you be able to take us down, how you consult with the patient? Like, how do you talk to them about either, trying the laser for a certain disease? Because obviously with the laser, we're paying out of pocket. So, how do patients react, you know, along the lines of the consultation and then having to either, pay out of pocket and not paying insurance? Can you try to describe that for us?
Okay. Um, so are you talking about like rosacea now?
So whether it be acne or rosacea,
Yeah, okay, let's talk about
again,
acne because I think that's where it's a little difficult. The rosacea patients in general tend to be a bit older, let's say, and that's such a chronic condition that, like I said, usually they're sick of it by the time they get to our offices. But acne, people come in, I think they expect to be treated with prescriptions, and I suppose if I saw someone completely de novo that had never been treated with anything, an acne patient, I don't think I would say I'm going to treat you right away with Neo. I think I would possibly discuss it, but and you know what? Come to think of it, I mean, it depends because you see someone who has inflammatory acne, and I know that with the Neo, we can get them pretty nice and clear within 2 months. So there's one way of talking about it. The other way is a lot of people don't want people that, like parents don't want their kids on particularly oral medication. So if you're getting to the antibiotic stage, that's definitely where it's a great segue because a lot of people don't want to do that. So you might do a couple topicals, see how that does. And again, acne, the same thing. It's a process. Teenagers know they're going to have acne for a while. They get sick of it. Everybody wants treatment that's effective right away. So you can discuss it if you feel they're quite anxious to get treated quickly, then they're going to be amenable to using the Neo. Or if they've already been disgusted with the treatment that they've had, or some people even have just only done over-the-counter treatment, and yet they're tired of it. And as soon as you say, well, here's a nice tretinoin plus BPO plus whatever, here's 2 medications you're going to be putting on morning and night. Don't expect to see any results for at least 6 weeks. That's your conventional medical therapy. When you talk about Neo, you can see results within a week. So that's a big differentiating feature.
So on the topic of acne, have you been able to treat any, difficult conditions, let's say like hormonal acne, around the chin or the jawline for females or any cystic cases?
Yes, I have, and it's done well. It's doing very well.
Any case that comes to mind, and why?
Yeah, I have a couple of women that have those inflammatory lesions, not as bad as the patient of Michael Gold that was the isotretinoin failure, but that have that cystic type of, no, not cystic, but definitely large papules, and you just hammer them down with that 2 millimeter spot size, and it's almost like injecting, really, except it's a much more appropriate, much more destructive in the good way that we want it to be destructive. It's going to destroy the lesion as opposed to the potential side effects that we have with the lesional catalog.
Okay. So we're approaching the 9 o'clock hour mark here, and I just wanted to switch gears real quick. So we discussed a lot of different topics here, and I want to go back to the first one about the state of healthcare. And I just wanted to ask you, if there's any, for anyone listening out there, what you think would be the biggest takeaway, for what's going on and what they need to do.
My biggest, what I think people need to do, take away, from this lecture. Mm-hmm. Well, I think keeping our eyes open is very important. And again, when I said when we start to see things slowing down, my first thought is, oh, what are the doctors no longer referring to me? Did I upset somebody? What did I do? We kind of always think it's about us. And here it's this gigantic thing that has nothing to do with us, but we are just a little, sand in the wheel of this giant machine. And so, but we want to preserve what we have. We want to take care of our patients the best way that we can. And this affords us such a wonderful opportunity to treat patients to the best of our abilities, just like we kind of used to be able to. I like that slide where it says this gets us back. I do feel rejuvenated mentally, as well as, needless to say, my own skin has been rejuvenated with the Neo. But it's fun to talk to people about this and to get them excited about doing this. And of course, if you're thinking of getting this device, you'll look at it and you won't have the confidence in the first month or so because you haven't seen your own patients back. Once you do start seeing your own patients back and you see how patients feel about this, you know they're going to tell people, and we are going to be able to keep people out of the minute clinics and coming back to us because they're happy, their friends are happy, and we all know that word of mouth is the best referral system, the best form of advertisement. And that's certainly what I'm already starting to see with my patients who have been treated with a neo.
All right. I think that's an excellent uh, sentiment to close on. So I want to thank everyone for listening, and I want to thank you for the awesome presentation, Dr. Harkaway. We really appreciate everything that you've done for us.
Oh, sure. And thanks everybody for joining us tonight.